Moved from our regular time. We need a little bit more time today to work through some things that we're dealing with regarding our COVID response. And so, again, it's Wednesday, but we have a council meeting tonight. We'll be talking about some of the items here tonight at our council meeting. Kind of wanted to lead off with why we pushed this presser a little bit back today. We just had some great meetings this morning with our healthcare partners. We've had a lot of correspondence with the state this morning as well on different modeling that, quite honestly, changes day by day. And I know I've said that before, but it's just so true. And the deeper we get into the COVID response in our community, the more data we have, the more accurate the models become, the better the decision-making process becomes. The data that we saw this morning, I think, continues to reinforce how we've responded as a community, how we've responded on the local level. One of the couple key things from that. One is we are certainly preparing for a mid-May peak in Sioux Falls. So mid-May is when we expect to see kind of the apex of COVID cases here in Sioux Falls and Minnehaha and Lincoln County. That's going to be sooner than the rest of the state. And that's probably not telling you anything you don't already know based on the cases that we're seeing to date in our counties here. At that point, we are currently estimating that we'll need up to 1,200 beds to deal with COVID. So we are going to be getting a presentation Friday. That will be an open presentation to our city council from our healthcare partners to kind of reinforce some of these data points that they've shared with us. One thing that was important that we went through this morning is, and I want to reinforce a couple things before I get into that. One is the fact that we have been taking the measures we've been taking to date as a community, they are working. Okay? They are having impact. So I want to reinforce that. I know the governor has reinforced that too, and she's right in that this is working. One thing, though, that we study a lot is different models that show the effect of our social distancing measures to date, what enhanced measures would take, like a stay-at-home, which we're going to talk about, and then what a complete, total shelter-in-place draconian shutdown would have on those numbers. And there's kind of three different models that you can look at. We're really in model one, where the ordinances that we put in place, the executive orders from the governor, my proclamation, just the continuing messages to stay home, have had impact. If we take it to the next level, which is what we're proposing in our council tonight, we have the chance to cut our ICU bed utilization or needs in half when we get to that peak. That was something that was shared this morning in our data presentation as well. And so that peak caseload that we'll see mid-May, if the projections are right, is bumping up on the ceiling of the capacity of our healthcare organizations. And so tonight, as you know, we're going to have a first reading of a stay-at-home order for the city of Sioux Falls. What that will do, if it's enacted, it would go into effect not until April 24. Okay, so again, I just had a talk with one of our healthcare executives this morning, and I said we have to somewhat be proactive or preempt what we think is going to be coming in terms of cases, in terms of modeling, in terms of data, because of this cycle of government, which is good, that we have to operate within. So even if we pass something next Tuesday night, it has to be 3 days before that goes into effect, so which means next Friday. So some communities call this shelter in place, some call it a stay at home, some call it different things. We're calling this a stay at home order. A stay at home order would really limit individuals' movements outside of their home unless they need to leave for essential activities and to work in what are called critical infrastructure jobs. CISA. Critical infrastructure jobs, those are defined by the Department of Homeland Security, Cybersecurity, and Infrastructure Security. And so those are listed at CISA, and they're attached to our ordinance, actually. We also added some additional clarification to that of some industries that aren't in the CISA clarification but are important to us here in Sioux Falls. And so you can find those in that ordinance. I'm not going to go through that whole list here in this briefing. Essential activities include, health and safety activities, doctor's appointments, visiting clinicians, outdoor activities, while still practicing smart social distancing, are certainly acceptable under stay-at-home order. Obviously your necessary services, your groceries, your gas, getting food, carry out, all those things are still allowed under stay-at-home. And then obviously the care for others, care for family, care for friends. Moving, someone said, if I have to move, I line up a truck and I move. Yeah, you can absolutely move. I think it's important to understand that between now, tonight, our first reading, and next Tuesday night, we have 6 days. Thinking of this like dog years, it's about 6 years in COVID time. So our city council is going to have a lot of time to digest what this could mean for our community, if they think it's the right move or not. We'll have probably more data by that time as well. And so it's not as nimble as sometimes we'd like it to be, but it also will allow them to have enough time to make, I think, a very informed decision come next Tuesday night. Another change that we're bringing forward tonight is a resolution that will recommend some adjustments to our current public transit. And we have seen a ridership really just drop off a cliff with transit right now. As of April 7, we've seen a 65% reduction in fixed route ridership. We've seen an 85% reduction in paratransit ridership. 36% of their drivers meet the vulnerable individual definition under the governor's EO, so making them required to stay at home. And so our PTAB board, that's our public transit advisory board, they're meeting this morning, they met this morning. They recommended and approved a change in the schedule there and reduced hours there. The Board of Health is meeting this afternoon. The City Council will consider that tonight, and those changes would go into effect Friday. No one ever likes to see transit affected, transit cut, but quite honestly, people aren't using public transit right now. And so it's not sustainable to continue to operate that. And I will also say the union membership of our transit is in support of this as well. They feel that they need to do this. You can find out more on that at siouxfalls.org/SAM. Broken record time is here, where I say this is fluid, fluid, fluid. If you would see the emotions in our room, if you think we're all locked arms behind that wall and all high-fiving and agreeing on every direction we're taking, you are sorely mistaken, because things change hour by hour on our responses and how to keep the community safe, how to protect businesses, how to protect our economy, and how to protect your rights. Now that we're putting a a stay-at-home ordinance on the books and officially putting it out there, I called everything from Hitler to Mayor Mussolini to everything in between. And you need to know that it pains me to have to bring things like this forward. I don't want to have to do that. But we're continuing to try and balance this very fluid, very delicate situation. So the state gave us some great direction this morning. We've had a lot of communication with the state, with the governor's office, and the Department of Health this morning. And so we feel confident in those projections and in that peak come mid-May. So that's what we're preparing for and working backward from right now. So my last message to the residents is, buckle in. I mean, we're May 15 right now, and we're preparing for a mid-May peak. So it's April 15 right now, excuse me. We're moving to a mid-May peak. So we still got 30 more days just until the peak, and then you don't just fall off after that. There's a lot of work to be done yet in this city. So with that, I would certainly open it up and take any questions you may have for me.
How is this stay-at-home ordinance different from what we're doing right now?
Well, sure. So what we're doing right now, one isn't legally enforceable, so it's not a law. So we have ordinances preventing businesses from the patron, 10 patrons or less, things like that. What we're saying under this is that you're required to go to work if you are an essential employee at a CISA-approved kind of critical infrastructure job, but then you're legally required to come home. Okay, we want you to go to work and come home. And people who don't abide by that and still gather in large groups technically could face a misdemeanor. That's not on the books right now. It also does some things as far as defining essential and non-essential employees at a time like this. And that's hard because every employee is essential. I hate that term because every employee is essential. So this is a more, it's a heavier-handed approach. I'll just call it what it is. It's a heavier-handed approach. It's a law. We're putting this into law. Making a mayoral proclamation, like I've done in the past, is a proclamation. There's no teeth to it. This actually has more teeth to it. Now, do we intend to have our police officers and our law enforcement writing tickets everywhere? No, this is an education effort. Texting while driving is illegal as well. Do people still do it? Yes. Do we give people a lot of grace? Yes. And so this is a law we're putting on the books to ensure an enhanced level of compliance amongst our citizens.
You know, in the ordinance, it seems like there's maybe some gray area. I mean, you've got your list of critical infrastructure jobs. You don't see medical workers listed there. You don't see restaurant workers or grocers. But then when you see essential activities, you see restaurants, grocery stores, things like that. I mean, can you help us justify the two, bridge the two things? Because you would assume, if these stores are going to be open,
right,
their workers have to be coming to work, but they're not critical infrastructure workers. So how do you rectify?
Sorry. You got it? Got my audio back. Okay, the question was gray area in the definition of businesses. Medical workers aren't listed. They're certainly listed in the CISA 13-page document that lists every category of worker. We've added additional clarification of businesses categories that aren't listed in CISA that we feel need to also stay open in the Sioux Falls market. For instance, biotech. That's not listed in CISA, but that's very critical to our economy. So.
The South Dakota Retailers Association is hoping that the council will reconsider this ordinance. What would you say to people who are even more worried about their businesses after this could potentially go into effect?
Yeah, the question was the Retailers Association is not supportive of this. I wouldn't expect them to be. Honestly, there's times when it's hard for me to be supportive of some of this stuff too. The question was then, what would you say to them and to the businesses that are going to be impacted by this? What I would say is we're all in an environment right now where we're all a product of COVID. And we're all making decisions and having to deal with instances I never in my wildest dreams thought we'd be dealing with. And so it's hard for me right now to say to a business the right thing for you to do is to allow your employees to not come to work for the safety of the community. But that's the decision that I'm making right now. The council will have to weigh if that's the right decision right now or not. I hope they do. If they don't, we'll press on and persevere. I have spoken to a lot of businesses, though, and I will say there's been a lot of voluntary compliance in this, one. The second is a lot of businesses are complying or have closed just because they've already been so severely impacted it doesn't make sense for them to stay open anymore. And the third thing I'll say is this. We're proposing this for 2 weeks. Okay? We're not doing this a month at a time. We're proposing this for 2 weeks. Because as we lead up to crunch time come May, we're proposing this for a 2-week period. The council would have a chance to extend it. Or based on the data we have when this would come up for renewal, they can say, listen, it worked, it was effective, it moved the needle a bit, and we're going to lessen this or remove this now going forward. So I think a 2-week window gives our council enough time to react in a nimble fashion.
And I know you don't want to name every business on the list, but we've had a lot of questions about salons, including like hair and nails. How will they be affected in this new ordinance?
Salons and nail salons are not considered essential businesses. So the direction would be that those employees should stay at home, and all the other cities and states around the country that have similar ordinances in place. That's why the CARES Act has dollars and funds dedicated to helping with relief for the business owner, payroll protection program, for instance, to keep those employees paid. or different ways to keep income coming into those employees. So when we say you need to stay home and not go to your job, we're not doing that without some sort of a safety net that the federal government has also provided to ensure those employees can have some level of income coming in.
Are you really telling, I mean, in the ordinance that I read, it says no business is being forced to close,
Right.
correct?
Correct.
I mean, anybody can still go.
No business is being forced to close is the question, yeah. Right. We're not telling any business to close.
So if my hairstylist wants to keep going to her studio, she can do that?
She can. She would be in violation of this ordinance, but she can do that. We're not telling the business to close. We're telling her she should stay home. Yeah.
A little more gray area.
There's some gray area there, I guess you could call it. But like I said, it's kind of like saying, Joe, you need to drive 65 miles an hour. And as soon as you go 66, you know, you're breaking the law. Do you do it? I'm assuming you do. Oh, you don't? Well, I do. Okay. But the enforcement of that is we self-police ourselves. I set my speedometer on 65. I enforce myself. Do we have some people? Do we know business won't comply? Absolutely. And we kind of expect that, anticipate that. We've seen that in other markets around the country that have had to do this to try and flatten their curve. So it's tough because it's a tough ordinance to enforce, but it is a city ordinance.
Will people need to carry proof or documentation that what they're doing is essential?
No, the question was, will people have to carry a card or proof? Or no, we don't intend to have anything like that. Again, even the fact that you're asking me this question, will people have to carry a card to prove that they can be out of their home? I mean, I'm in the twilight zone right now. And I'm even having this conversation. It's just, I haven't eaten all day. It sucks, you know, it sucks to have to be having this conversation with you guys. I hope we're through it quickly. I do.
Do you think shelter in place countywide earlier on would have prevented the Smithfield situation from happening?
You know, it's hard to say. That Smithfield is essential business, so they would have continued to operate. So I don't know if Smithfield could have been prevented with government action, you know. And so some of the, I think maybe some of the spin-off cases, I think it's like 140, 150 cases of people, not Smithfield employees, but fiancés and spouses, things like that. That maybe could have helped a little bit. I'm not sure. So, but it's tough to say. You know, we drew a tough card with Smithfield. We're getting a lot of national attention for Smithfield. Smithfield is not the enemy in this. Pork producers not the enemy. The COVID is the enemy. So, on that note, we're working with the Smithfield leadership. Just sent an email out to their attorney today. We want them open. We want businesses open as quickly as possible, to reopen as quickly as possible. So I get some correspondence at times that I'm not friendly to business. Why would you do this? This isn't business friendly. Listen, I want to get these businesses back open and humming as quick as possible. Smithfield being one where we have our fourth largest employer sitting idle, and we need to get them open quickly, and we're working with them on a plan to open safely.
What is your reaction to all of the national attention that Sioux Falls has been getting, and are you worried about how this affects your ability to work with the governor?
You know, the question was about the attention Sioux Falls has been getting nationally, and, you know, Sioux Falls' ability to work well with peer. No, in fact, I was texting with the governor last night, and I said, Governor, I understand the position you're in. You know the position I'm in. I'm going to continue to do all I can to support your position. I know you'll do the same with me. It's not personal. None of this stuff ever gets personal. You can have differences of opinion on how to respond locally and statewide and still have a good relationship. And we've been in conversation with peer all morning, like I said, on stuff. So tension is good. Healthy tension is good. Will I say that I've learned some things from different responses, including our state's response, that I'm taking into account in how we're responding locally? Absolutely. And I would say vice versa. So it's good. We still have a great relationship with the governor, with her team and peer.
And your reaction to all the national attention we've been getting, what is that?
Well, it's not, I don't like having Sioux Falls be in the spotlight for having the #1 hotspot in the country. We're not used to being on these kind of lists in Sioux Falls. And so I don't like it. I don't like it. I want to fix it. I want to get past this. I want to send a message of reassurance that we're dealing with it. I want to send a message of reassurance to our business community that we're doing all we can to protect your business and keep you open as best we can while fixing the hot spot that we have and the situation we have. And so, do I say I like it? No. I've been contacted by about 15 media outlets today. I haven't talked to a single one because I don't have time. I mean, we're dealing with this issue. And so, it's a bummer. I wish they'd stop calling because that would mean there's not a story here anymore and we fixed our problem. So I'm looking forward to that day.
You say a peak of mid-May. I mean, is there a positive to having the peak out of the way early if it doesn't overwhelm capacity? I mean, does that mean we can get back to normal sooner?
Yeah, the question is, if we peak in mid-May, is there a positive to that than having it sooner rather than later? I think thinking more on a statewide level, if we would peak the same time as the state, our two largest healthcare systems are here. So if we can peak a little bit earlier and treat some of those folks here, and then the rest of the state will start to peak later than us, and we can treat those patients here, it is kind of a little bit of a blessing that there's not such an overlap. What we want to be careful to do, though, is ensure that we don't let off too quickly. It's like, all right, we peaked, we're good, because there's still, I would say, aftershocks, if you will, that will still be happening with COVID. And as we've said all along, we're not stopping it. We're just trying to slow it down. That's all we're doing, is trying to slow it down.
And then back to the new ordinance again. Under what circumstances do you envision police actually having to enforce the ordinance?
Question was, under what circumstances would the police have to enforce the ordinance? I would say gross negligence and gross disrespect of the ordinance. Okay, you throw your neighborhood block party, and this is passed. Like, come on, I would guess we would say, listen, do you know we're under a stay-at-home order right now? And if you'd say, absolutely we do, okay, that's probably a ticket. If you'd say, no, we didn't know that, all right. Well, if you could, kind of wind this down because we're under a stay-at-home order. So the last thing we want to do is have people fear for our police officers coming to enforce an ordinance that makes people fearful of our cops. So we're not turning into an overly police state that's telling you what you have to do and when you have to do it. But we are putting an ordinance on the books because we need to do that for this 2-week period. All right, thank you. I'm sure we'll see some of you at our council meeting tonight when our council discusses this. So they have a lot to think about. Thank you for being here.